do not allow that to trigger you to fall into your same old routines that you have, that put you in the place that you are in right now. And so I'll be talking about how you avoid those pitfalls. How do you avoid dealing with those stressors when you feel like, today I'd like to go, eat something unhealthy.
Right.
So I'm really going to be providing some education, but as I mentioned before, it's not just about education. It's about becoming educated, but then it's about using what you know and putting it into action. Likewise, I'll also be providing some social support. So, for example, this is going to be a very difficult challenge. On this Saturday for the launch, I saw some of the people do the baseline assessments, and they were getting worked out.
They were.
And so there may be some times where people feel like, hey, I want to give up. I don't think I can do this. This is really too challenging for me. And so if there's any time where someone needs to reach out to me, to talk with me about how they're doing, I've made myself available for that purpose.
Mm-hmm. I'm Al McFarland. You're listening to Conversations with Al McFarland. My guest is Dr. Darren Moore. He is in the psychology department teaches in the psychology department at Mercer University in Georgia. And he's a North Minneapolis native, a young PhD, I might add. I don't think you're 30 years old yet, are you, Doctor?
No.
You're not quite 30,
yes.
Young PhD. And a person that our community and his family, our families are all very proud of. So we're glad to have connected with him for his story and his leadership and his knowledge about mental health. That's his field of specialty. I think you're also a marriage counselor. Is that correct?
Correct. I do individual, couple, and family therapy. So I work with couples and families and individuals regarding a variety of mental health treatment issues.
Okay. And so, but when we first met, you talked about, and you kind of blew me away because you said that you had been obese, had been overweight. Well, I can tell you that Dr. Moore, in my view, is thin as a rail, and I can't even imagine him ever having been overweight just by looking at him right now. So tell me, Doc, about your growing up, how you were overweight, and what realizations got you on that track to make you the thin man you are today.
Oh, my. Yes, I have struggled with obesity and eating probably for a long time, probably during childhood. I remember, I think I was around maybe 8 or 9 years old, where I remember one of my friend's parents, and I won't say who they are, of course, but one of my friend's parents mentioned something about me being overweight. Mm-hmm. And they didn't mean any harm by it, but it really hurt my feelings and made me feel bad about myself. And I think that's when I really started to become more conscious of my body and about how my body looked and about my weight. And so throughout, I would say, elementary school and in middle school, weight was an issue. I remember being I think I was in the 7th grade at Franklin Junior High, because I went to Franklin. I'm sure lots of people went to Franklin when it was still open. Back in those days, which really wasn't that long ago, but I'll just say it that way because I am getting older, we had to go swimming for gym class. Mm-hmm. And I remember being so embarrassed with having to take my shirt off and get in the pool. And then, back then, guys are looking at girls and girls are looking at guys, and, people are very judgmental, and I just felt very embarrassed and uncomfortable, and that just made me to continue to have, a negative relationship with my body.
Okay.
High school, I struggled with eating too much, probably using food to cope with stress. It's just been a huge issue. And then I would say, moving on for college, I was diagnosed with obstructive sleep apnea.
Me too.
Which is a huge issue for a lot of people that are obese. Mm-hmm. And that was something that was a negative experience for me, to have to use a CPAP machine to sleep. Mm-hmm. It was just something that I was horrendous for me. And so I always kind of had this issue around eating. And so when I was in graduate school, getting my master's degree and then transitioning through to get my PhD, I just realized that I needed to get my life together. And I knew that I was uncomfortable with my weight, but I didn't really know how to go about this weight loss process. And I didn't really realize until I got the mental health training through my education how huge the mind is as it relates to this process. And so that's kind of what started to stimulate me thinking, so what is this about, because anyone can go on the internet and learn about, calories in versus calories out and et cetera, but it's not that simple. It's really more about how do you change your mindset, how do you motivate yourself, and how do you learn to use, positive, atmospheres and outlets to address any issues that you may have, as opposed to, oh, I'm feeling bad today, so I'm going to go eat. So it's really about a mindset, and it's through my education, I would say, and my life experiences that really made me say, you know what, when I look in the mirror, I don't like what I see. And if you don't like what you see, you get up and you do something about it.
Okay.
And that's something that I just, it didn't happen overnight. It took a lot of hard work, blood, sweat, tears, dedication. But it was something that I wanted for years. And so I put my all into it, just like I put my all into everything else that I do. People who know me know that I, try to do the best that I can in anything and everything that I do. And so I just poured out my heart and said, God, help me. Let me find, some resources. Let me find some people that I can learn from to help me to understand this obesity epidemic differently, and how can I apply some skills and techniques to my own mindset and then use that to be an example for others.
That's a great story, Darren Moore, Dr. Moore. And that's